Prior to your first appointment and surgery, be sure to follow these recommended guidelines so you're best prepared for your robotic-assisted prostatectomy. Before your first visit, we will need your PSA results, a written biopsy report from your urologist, and any bone, CT, or MRI scans your urologist has ordered. If you were diagnosed with prostate cancer outside of the Global Robotics Institute, we may need to do a second reading of the biopsy slides for a definitive diagnosis. During your first visit, we will review your records and condition with you and determine the best treatment plan for your individual needs. It is a good idea to write down any questions you have before your visit so that we can ensure you're best informed. If you decide to have surgery, you will meet with a registered nurse who will review the surgery consent paperwork and preoperative information packet. Within 3 to 7 business days, a surgery scheduler will contact you to provide necessary prescriptions and requisitions you will need to complete your preoperative clearance. We require that all of the preoperative testing be completed and sent to our office as soon as possible prior to surgery, with the exception of blood work. After the preoperative testing is received, a surgery date will be given. 4 weeks prior to surgery, it is critical to inform us of any prescriptions, especially blood-thinning medications you are on, such as Plavix, Pradaxa, and Coumadin or warfarin. We may need to develop a plan with your primary care physician or cardiologist about managing these medications before, during, and after surgery. It is also important to stop taking certain medications and herbal supplements prior to surgery, as some can interfere with anesthesia, affect bleeding or clotting, or interact with other medications. Preoperative blood work must be completed and delivered to our office 30 days prior to the assigned surgery date. 2 weeks prior to surgery, you must stop taking the following medications, as well as any of the previously addressed herbal supplements. All non-steroidal anti-inflammatory drugs such as Celebrex, aspirin products, any medications containing ibuprofen like Advil or Motrin, and any medications containing naproxen like Aleve. If needed, Tylenol or acetaminophen is safe to use up until the day before surgery. Leading up to your prostatectomy, our concierge will contact you to confirm your surgery and provide meeting instructions for the day of your procedure. 48 hours before surgery, avoid heavy, greasy meals or high-protein foods like steak. Instead, keep meals light, like soups, salads, chicken, and fish, and do not drink any alcohol beyond this point. 24 hours before surgery, follow a clear liquid diet which includes anything you can see through, like popsicles, Jell-O, water, apple juice, and chicken broth, but do not consume anything with red or purple dyes. Be sure to stop taking any oral medications for type 2 diabetes, including metformin and glipizide. There is a particular preoperative antiseptic cleanser, 4% chlorhexidine gluconate, that is required for shower usage prior to surgery. We typically recommend using this cleanser, which can be found over the counter at most drugstores, at least twice before your operation. You will receive more detailed instructions regarding this in the paperwork given to you by your surgery scheduler. On the day of surgery, do not take any diuretics such as hydrochlorothiazide, prescribed separately from your hypertension medications. Also, type 1 diabetics, insulin-dependent patients should not take insulin the day of surgery. Instead, these medications should be taken the day or evening before surgery. Patients with an indwelling insulin pump must notify the anesthesiologist prior to surgery. Do not eat anything on the morning of surgery, including chewing gum, tobacco products, and mints. You may have water or Gatorade up to 2 hours before your arrival. All prescription medications for the treatment of hypertension, except for diuretics, should be taken on the morning of surgery with small sips of water only. No other food or drink, and be sure to tell us if you are taking any blood-thinning medication, such as Plavix, Pradaxa, Coumadin, or warfarin. When you arrive for surgery, bring with you slip-on street shoes, a robe, and very loose drawstring or elastic shorts or pants, along with a complete list of home medications and dosages to review with the preoperative nurse prior to surgery. Your procedure will be taking place at AdventHealth Celebration, and you may either valet your car or park in the lots in front of the building. You will need to report to the hospital main entrance. Our concierge will meet you in the front lobby of the hospital to escort you to the surgery area and walk you through the process. After the surgery is completed, Dr. Patel will call your family and give you an update on your status. Review these preoperative instructions until you feel comfortable. If you still have questions, do not hesitate to contact our office. Thank you.